From KUNC and the NPR network, this is In The NoCo. I'm Erin O'Toole. Okay, let's see just how dedicated you are as an In The NoCo listener. Because on today's episode, we're talking about measles in the sewer. Are you still with me? Good, because this is actually pretty cool. Back in August, health officials in Mesa County on Colorado's western slope fielded a report of a measles outbreak involving 7 people. Measles outbreaks have been flaring up around the country this year, so public health officials were on alert. But the health officials in Mesa County had basically detected these cases before they were actually reported. They did that by monitoring the county's wastewater system.
So public health agencies have been prepared. They were able to get sort of a jump on their immediate response and really were able to start ramping up the case investigation and be ready with that team when the first cases started popping up in the clinics.
That's John Ingold, the Colorado Sun's health reporter. He looked into how the detection system works and how widespread this type of disease monitoring is in Colorado. John, I have to start by commending you for your very tactful word choices in an article that basically revolves around poop. How did you hear about these cases?
Well, so in fairness, originally we said that in the headline that they were trying to sniff out measles in the sewer system. And then we thought, nah, let's just keep it professional here. Let's avoid the puns. I cover health and I have been following measles cases across the state this year. And this was one, the outbreak itself, that I was watching closely because it was kind of alarming how it popped up. These cases, the first 2 cases that were identified out in Mesa County, just kind of came from nowhere. They were people who hadn't traveled anywhere. They were people who hadn't had contact with people who were known to be infected. So they were infections from an unknown source. And that raises the possibility that what we were seeing here is silent spread throughout the community in Grand Junction and the rest of Mesa County. And that would be really alarming. That would be something that could set that area up for a much bigger outbreak.
Yeah.
But it didn't end up happening. The public health got ahead of it. There were a few more cases, and then the outbreak ended. And so I really wanted to know, well, what was it that set you up for success here? What happened that worked so well? And that was where I heard about the wastewater testing for measles.
Yeah, the cases that were detected early in Mesa County seem like a pretty big success story in your article. How unusual is it for health officials to detect an outbreak this way?
Well, so wastewater testing as a public health tool has been around since at least kind of the middle of the COVID pandemic is when public health officials started doing this. And we remember this back from COVID times. The state started monitoring wastewater. And what they were looking for were big sort of macro changes to infection patterns. So lots of people getting sick. They were looking for the beginning of surges. Like if you saw that there was a big uptick in infections detected in wastewater, then you would expect, okay, in a couple weeks, in a week or so, we might see a big influx of people coming into the hospital. So it was on this like way overarching level, something they were using to try to track trends. This is something different. The state had launched back in the spring a pilot project to look for measles in wastewater. And what they're trying to do here isn't so much like overall surveillance. They're trying to do disease detection. They're trying to find the 1 case or the 2 cases in a specific area and spot them before those people start going into clinics. That way you can notify doctors ahead of time, hey, we think there might be measles here.
And that seems helpful because my understanding is, with measles being technically eradicated, some health professionals aren't used to seeing it show up in their clinics, so this sounds like an extra way to get them prepared for that. John, I'm curious how precise the monitoring is. I mean, can they pinpoint an outbreak to like an individual neighborhood or a house?
So the state has set up what it calls a sentinel surveillance network here for wastewater. So that's 20 systems across the state. It covers something like 65% of the Colorado population. And they're taking tests at sort of centralized locations within those systems. So no, to your question, it cannot pinpoint, hey, it came from that street or it came from this neighborhood. It just says like broadly in this community, we've detected it.
You mentioned how officials began testing wastewater to track COVID outbreaks and have continued monitoring for traces of illness since then. What other types of diseases are health officials looking for in our wastewater?
Well, so far we're still watching for COVID, and obviously, like I said, we have the pilot project for measles. The hope here is that by showing that it works in the measles instance, and so this is what makes the Mesa County case so important, is that it's sort of validation that, hey, we had a hit like 2 days before the first case popped up in Mesa County that said, it looks like there's measles in Mesa County. So by showing that this like kind of micro detection can actually work, now the state could roll this out for any pathogen that could come out, any sort of emerging pathogen that you might say in public health speak. So if there's a new virus that you want to search for, you could roll it out that way. If there's something super scary that you want to monitor for, there you could be using wastewater testing as another tool in your toolbox.
I mean, measles is still fairly uncommon. Would it be harder to monitor for a very common virus, something like the flu, using wastewater?
Well, I think to monitor flu trends, absolutely, you could use wastewater.
Okay, so maybe this is because I'm not used to hearing about this form of disease surveillance, but something about monitoring my sewage makes me raise an eyebrow. John, how concerned are privacy advocates about this monitoring?
Well, again, it's not something that is occurring like right outside your house. The state or the local public health is not like dipping a little dipper in your sewer line just right outside your house to see what's going on. It's something that's centralized at the water treatment facilities. And certainly I had this image in my head when I think wastewater testing. So I had to learn to have it dispelled that when we talk wastewater testing, they're taking these little samples out and filling up a jug and sending it off to get tested at the state lab. By the time they're doing that, it basically looks like just slightly murky water, right? There's a lot more that goes into our wastewater system than what just gets flushed down the toilet.
So, I mean, it sounds like the system worked in this case in Mesa County because the number of known measles cases returned to zero in a few weeks. Do health officials consider that kind of a success story?
Yeah, I think they are guarded by nature and how they declare success, because obviously measles could come back again. But I would say everybody I talked to in their own, very kind of cautious, nerdy way was super psyched that this worked out this way, and that it was a good demonstration for the work of public health, being able to launch a case investigation, do contact tracing, sort of get out ahead of things and stop an outbreak from spiraling out of control.
John Ingold covers health for the Colorado Sun. He spoke with me about how public health agencies are monitoring wastewater for early detection of measles outbreaks in communities across the state. You'll find a link to his story in our show notes and at kunc.org. We'll also include a link to a recent In The NoCo conversation with a Denver-based pediatrician about measles vaccinations in Colorado. Again, that's in our show notes and at kunc.org. That's it today for In The NoCo. I'm Erin O'Toole. Thanks so much for listening.